Hey everybody, Dr. Adam Hughes here. This is going to be the first of a series of videos that we're going to be putting out from the office here in Columbia, Tennessee. This is just going to be geared towards educating people and our patients just on various types of health topics. And over the last couple of years, one of the big things that we have started doing here in our office is supporting a lot of patients who have thyroid conditions. It's just something that we've been able to get really good results with our functional neurology and functional medicine and nutrition. And today I wanted to briefly talk about, some of the top reasons why a lot of our thyroid patients come in and they've probably been diagnosed with a thyroid problem for a number of years, and yet they just don't feel any better. Even though they may be taking medications and doing everything that their other doctors tell them to do, yet they're still suffering with the same old types of symptoms. They're cold all the time, they're tired all the time, they're constipated, they're depressed, the list goes on and on. So today I wanted to cover probably the top 3 reasons why that is for a lot of these thyroid patients. And it all starts with, anytime you have any type of condition like this, you have to take a step back and really look at the person, because there's more than just a label or a diagnosis going on. So, what are we looking at? Well, probably the number one reason why thyroid patients develop these problems over the years and they don't feel any better even with the medication is because they're autoimmune. They have an autoimmune thyroid condition, but chances are they don't know it because they've never really been tested for it. But autoimmune thyroid, or Hashimoto's thyroiditis, is by far the number one reason in America that people develop thyroid conditions. And just a brief explanation of it, autoimmune thyroid basically just means that your body's own immune system is attacking your thyroid and doing all of the damage. Therefore, your thyroid isn't going to be able to function like it's supposed to. It's not going to be able to make thyroid hormones, the T3 and T4, like it's supposed to. Therefore, your body's not going to be able to use those hormones to perform a number of other types of functions and organ systems. So your body can't do it when the immune system is constantly attacking the thyroid. And as I said, this is the number one reason in America that up to 90% of people with thyroid problems, that's the reason why they have it. But the problem is they don't know it. And another problem is, a lot of times people will develop this type of problem. They get on the medication, a T4 type of hormone or something like that, and they might feel better just for a little bit, but then the symptoms come right back. And that's typically because you're not dealing with a thyroid problem. You're dealing with an immune system problem. Therefore, the immune system must be taken into account, and it needs to be controlled and modulated as much as possible. But the reasons why most medical doctors don't do this is because it really doesn't matter to them that the immune system is involved, because they know that there's nothing they can do about it. In other words, they're just going to give you the hormone and that's it, because they know eventually your immune system is going to eat up your thyroid, and therefore you're just going to need that hormone anyway. But what it helps, though, is to take a step back and figure out ways that you can control the immune system better. You can actually prevent the immune system from attacking the thyroid by looking at environmental factors. Okay, so the next reason kind of goes back to what we talked about earlier as far as autoimmune. A lot of people don't realize they're autoimmune because they haven't been tested. Well, that goes the same for other types of thyroid conditions as well. Most patients just haven't been tested properly, and even when they are tested, most medical doctors are going by the typical lab ranges. In other words, that line of numbers that they're comparing your numbers to is basically what most doctors are going by. But those are essentially lab ranges. Those ranges are based on an average and a bell curve of whoever got tested at that lab facility. So basically you're being compared to a very broad range. Whereas there are ranges we call functional or optimal ranges, which are more narrow. Therefore, you can get a much clearer picture by comparing, your blood work to functional ranges to actually let you know, is your body actually doing what it's supposed to be doing? Is the thyroid, or is the stomach, or the liver, or any other type of organ? You can get a much clearer picture if you're comparing yourself with optimal ranges. Okay? For instance, your typical TSH, thyroid stimulating hormone lab range might be anywhere from 0.5 to 5.0. Now that's a pretty large reference range. Okay? So a lot of people end up somewhere in there, and even though you're having all these symptoms and crazy problems, your doctor's saying, nope, you're fine, that's normal. But the fact is, the functional range, or where your thyroid stimulating hormone is, you know it's working the best and it's where your body needs it to be, that range is between 1.5 and 3.0. So what happens is a lot of people will fall outside of this range even though their doctor's saying they're normal, but you're not working optimally. Your thyroid stimulating hormone is not where it should be from an optimal or functional standpoint, and you still end up getting those different types of symptoms. So it helps, once again, to look at the functional ranges and finding somebody to help you look at the functional ranges to figure out where exactly you are. Now, the last portion is another big issue, and this deals with what we call conversion problems. Okay? Now, without going on for another 20 minutes, your body, or your thyroid, makes two different thyroid hormones. Your thyroid pumps out T4 and T3. Now, T4 is about 93% of what the thyroid makes. So it makes T4, that's 93% of what it makes. Whereas T3 only counts for about 7% of what your thyroid makes. So, and the thing is, T3 is the active form of thyroid hormone. So T3 is ready to be used by your body within all the cells. The T4 has to be converted into T3 for it to be used by the body. Okay? So that means your thyroid could be pumping out these different hormones just like it should, but the problem is, in order for this to happen, in order for this conversion to happen, that has to happen somewhere else in your body. Okay? For instance, a large portion of that conversion takes place in your liver. And then another portion, or another big portion, takes place in your gut and digestive tract. So, here's another scenario. Maybe your thyroid is working like it's supposed to. You don't have Hashimoto's, and your thyroid is making hormones just like it should. So it's making this T4 and a lot of it. However, if you're dealing with some type of liver stress, or some type of gut or digestive stress, and that doesn't necessarily mean a disease, okay? We're not talking about a disease here. We're talking about a dysfunction. You know, your liver is clogged up because of your bad dietary habits, or you have a chronic gut infection, or you've been on a ton of antibiotics, or you're taking Prilosec all the time because you're not digesting things to begin with and you're getting heartburn. All of those will cause distress and dysfunction within your liver and within your digestive system. Therefore, it's going to be harder for this T4 to get converted into T3 so your body can actually use that hormone. And when that happens, you don't have enough hormone to get into your cells to be used by the body to create all the other functions that your thyroid hormones will help your body do. So, I know that's a lot, but those are some of the main reasons why we see people coming in all the time. They're taking their thyroid medications, they're doing exactly what they think they're supposed to be doing, yet they don't get better. The symptoms persist, they feel tired all the time, sick all the time, and yet their doctors, keep coming back saying, nope, your blood tests are fine, your TSH is within the healthy range, even though a lot of times it's not. Or you're dealing with an immune system problem and not a thyroid problem. So I hope maybe this sheds some light on maybe your particular situation or someone you love. Maybe if they're dealing with these types of problems, these are the things they want to look into. These are the things they want to take a much closer look at, or find somebody who can help them take a much closer look at it. Looking at, do you actually have an autoimmune condition? Are you converting your T4 to T3? Are you having too much gut and liver stresses? And of course, comparing those functional ranges, or your lab work, to those functional ranges. It'll make a huge difference in your health and as far as getting better if you're dealing with these types of thyroid problems, if you just start with these. So I hope this sheds some light. If you have any questions, feel free to call our office here in Columbia, Tennessee, 931-380-1144. We're here to help you with anything we can, and I hope you have a great day.